So firstly, I would like to thank you for the very informative and interesting session today. And we are very grateful to have your presence in our institution. And it's my privilege to have an interview with you today.
Thank you.
As a budding physiotherapist, I, on behalf of the students of Dr.M.G.R. Educational and Research Institute, I would like to ask you a few questions, sir. So what are the advices you would like to give to budding physiotherapists in India?
Advices, if you ask me, personally I'm not the person who will be taking an advice, but it can be like suggestions from my side. So the suggestions could be, first important thing is being patient with everything, like being patient in acquiring knowledge, being patient in your class, being patient in your clinic, being patient in getting patients. Being patient with patients is one of the primary importance. So if you ask me one of the key advice or suggestion, I would say being patient, and that can help us understand a lot of things, what the other person is going through and what yourself are going through. I think that can help one get better.
Okay, sir. So according to you, what are the key skills should a physiotherapist have?
Yes. So there are two major skills what we need to have. One is the listening skill, the second is the understanding skills. So even though this is not directly related to physiotherapy, but I think by now most of the physiotherapists know what they need to acquire as physical skill, I mean to say, but not a lot of effort has been put towards understanding and listening skills. So listening and understanding are key skills which are required for us to practice as a effective physiotherapist. Let me say, personally in my professional practice, I see a lot of patients getting better more because of the communication or more because of understanding them rather than physically treating them. I would say physical treatment also gives a lot of improvement, but more than that, understanding them, listening to their problems and giving them useful suggestions or guiding them the right track can help them get better.
Okay, sir. So can you tell me, how did you develop your interest and inclination towards treating scoliosis patient, and what are the patient's expectations, and how do you manage to meet your patient's expectations, sir?
Firstly, scoliosis interest started in me during 2014. Okay, when I took the first course, which was on Schroth method, done by Dr. Manuel Rigo. It was from the Barcelona Scoliosis Physiotherapy School. So that gave me a lot of interest in scoliosis, and during that training program I had to see a patient for continuously for about 10 to 12 days was the training program. I can visually see the change that the exercises had brought in him. So far, before I was handling scoliosis, much of the other cases were related to orthopedic neurological cases, but the recovery would take time. Okay, and with scoliosis I could instantly see certain results that can happen, and that brought a bigger change in patients' orientation and acceptance towards me as a physiotherapist. That gave me a lot of interest to carry out in this field. Then I explored a lot more different courses related to scoliosis, wherein I found out other teachers and other programs also, like the CEAS method, Leon, side shift, etc. Then I started equipping myself with more into treating people with scoliosis. But side by side I was doing my other practice as well related to managing pain, cerebral palsy, other pediatric conditions also. But scoliosis became my passion because I could give some instant results what the patients were asking for. I think that could answer your second question, right? So what are the patient expectations? The patient expects an immediate recovery, and exercises and scoliosis is something where I can give an instant result to them, especially with musculoskeletal scoliosis. So that's how I manage the patient expectation. We put some small goals and we try to meet them. If the goals are not met, then we give them some alternate goals, and the treatment line is towards that. And I think scoliosis is such a condition wherein these kind of treatments gels well with that. Okay, and when we start explaining patients that this is what this treatment is going to do to them, and setting realistic expectation, so that's what is very important. So setting unrealistic goals, unrealistic expectation, not saying them like I'm going to make your curve to 0. That is something like an unrealistic goal for already a curve which is worsening. Okay, setting them small goals, setting them realistic goals, that this is what is expected in 1 month time, this is what is expected in 2 months time, that will help them in getting them better as well.
Yes, sir. Okay, sir. So in your passion for physiotherapy, what are your futuristic vision and what is your future goals?
Yes, I think it should go well with the question itself. So futuristic, so we are in the futuristic generation where a lot of inclination is towards technology. Technology in physiotherapy and rehabilitation is on the rise. and the pandemic, the COVID also has brought up a lot of inclination towards this tele-rehabilitation, online consultations, online physiotherapy sessions, and use of different devices that can track the patient's movement, wherein we can be like an aid for them in doing it at remote rehabilitation, wherein we need not be present physically with the patient. Especially for me, during the COVID, so far as a physiotherapist, I have never treated any patient with through online mode of practice. So that is a step forward, I think. So in the near future, what we're expecting is like, I need not be physically present on the patient zone itself, but I can still give them good, much better benefit. So that is the futuristic goal, like taking physiotherapy to the next level.
Okay, sir. So as a budding physiotherapist, we are just starting to see patients. So how do you manage your work stress, sir? How do you handle it?
Yes, as a physiotherapist, we are not only dealing with work stress, a lot of physical stress as
sir.
well. So first thing, managing physical stress is to keep ourselves healthy and fit. That is very important. And a lot of mental stress or psychological stress can come to us when we are taking in too much things to us. For example, say there should be a effective patient-therapist relationship also should be there in such a way that we are not taking in much of patient's problems. Like what we say, no, don't sympathize with them much, but give them a lot of empathy or empathize towards them. That can go a long way in reducing our stress as well, because a lot of time I see the stress for the physiotherapist is due to when a patient is not getting better, when the patient's condition is getting worse. Okay, these are things that can cause us more stress, or in vice versa, when we are seeing too many patients, that gives a lot of stress to us, and when there is less patients also, there is stress to us, we don't have any patients, etc. So trying to see everything neutrally, trying to see everything balanced can help them deal the stress with. And again, a lot of psychological things like meditation, mindfulness, everything you can practice. So stress is something, is a drive force for us. Okay, we need to have stress, but stress needs to be at the minimal or baseline level. That helps us to drive more.
Okay, changing stress into a positive one, rightly said, sir. So in your journey as a physiotherapist, how do you handle a patient who's not cooperative, and what is the hardest case you have worked on till now, sir?
Okay, that requires a lot of thinking for me to do. So the hardest case, I think it all depends on our mindset. Okay, when you think that an ex-patient is somebody who is hard for you to treat, then our journey stops there. Okay, so taking hardest case or hard case as your challenge can help in overcoming that. Okay, so through my journey I've seen a lot of hard cases. Okay, so I give my 100% whatever it is to help them get better with it. If it is not working out, then I obviously refer to my colleagues. That is one way to deal with hard case. Okay, for example, a child with cerebral palsy with multiple disabilities. Okay, where, or for example, say a child with autism. Okay, where much of their speciality is towards another professional who can able to handle them better. So I refer them to the other professionals who can able to better handle them. Okay, so too many hard things will make our job also more harder than what we are presently doing. So I take up hard cases, but I make sure that it is in the limit of my practice and I can able to give them a better justice for what I'm doing or treating with them. So that is the way to handle hardest case. The next question was about non-cooperative patient. Yes. So especially being a neurophysiotherapist, we do get a lot of patients who are non-cooperative. Okay, a lot of talking with them, a lot of understanding them. Many a times we need to go down to their levels. For example, say a lot of pediatric children, we need to go to a very play therapy mode, play with them, get accustomed to them. So that will help them. That will help us in getting their cooperativeness towards our treatment, etc. Straight away, not starting with the treatment initially, but start as a play, then gel well with them, being with the parents, speaking to them, talking to them. Especially when handling children who are like especially non-cooperative, it is very important for us to get them one in their family or in their group. Okay, so that they start accepting us. For me, non-cooperativeness comes when they don't accept us. Okay, giving our 100% and getting them accepting us as part of their group or the family will help in overcoming this.
Okay, sir. So you're a very successful physiotherapist. What advices you would give us to climb up the ladder of success in career?
Okay, but I will stay there. So I'm still trying to be a successful physiotherapist, but thanks for that. Okay, so I'm still climbing up the ladder. Okay, it is to take one step at a time, one day at a time. It is not something which comes on the plate. You need to definitely put a lot of hard work, but a lot of hard work and smart work is essential at this present generation. Okay, because when you there were times I put a lot of hard work, okay, but still there were not much outcomes. But there are times when I put hard work and I got the results as well. Then I realized there is a lot of smart work involved in it. Okay, as a physiotherapist, we need to have both in tandem. Okay, and try to look for other opportunities. Okay, in physiotherapy itself, there are many unexplored areas which can give us a lot of scope for practice and improvising yourself. And don't take failure as something more hard onto you. Okay, take failure as something your stepping stone, like everybody says. Okay, and put in your work, because you need to give something to get the outcome.
Yes.
Unless you are putting the step forward, you won't reach to the next step. Okay, so taking it one step at a time, one day at a time, can help in reaching up. If not being successful, at least you are satisfied. Okay, being satisfied for me is like a success. Correct?
Yes. Satisfaction is the main component of work, right?
Yes.
Sir, according to you, what is the role of physiotherapist in Indian society, sir?
There are a lot of roles that we play. As you know, from the branches of physiotherapy itself, it is not secluded to, for example, say only for sports or only for orthopedics, only for cardio. So the role of or the scope of practice of physiotherapy as such is many. Okay, I think the present Prime Minister also has taken the motto of Health India or Fit India movement, wherein physiotherapy is something which can help people even with disabilities or even with a problem, or even with people who are without disabilities or without any problems itself. Like the physiotherapy starts even from the preventive stage itself. Like presently there are a lot of challenges people face with the lifestyle disorders. People get early heart attacks, people get early stroke, etc., which can better be managed if physiotherapy starts at the preventive role itself. So going forward, what I feel is, especially in Indian society where there's a lot of change, cultural change, where there's a lot of lifestyle change it's happening, and especially after the COVID, where people are more prone towards working from home, etc., where there's not a lot of physical activities at present happening. So physiotherapy's role is very important, because we make the patients move. Okay, and movement is one of the best medicine what we know, and I think what everybody knows by now. So physiotherapy in India is the future. So that can start from us, I think. So all you present budding physiotherapists are the ones who are going to take it to the next level.
Yes, very rightly said, sir. Thank you for the very insightful replies to my question. You have explained all my questions with lots of patience and passion. It's again, I would like to say it's my privilege to interview, sir. Thank you.
Thank you so much, and thank you for the opportunity, and thanks to the team of Dr.M.G.R. Educational Research Institute. Thanks everyone.
Thank you.